Hey, joining me now, we're pretty fired up, is Sean Connaughton. He is the president and CEO of the Virginia Hospital and Healthcare Association. Sean, a military veteran, also was our transportation secretary, and he's also served as a local elected official in Virginia and as a state cabinet secretary and head of transportation, now becoming a regular on our show because I am determined to ring the alarm bells about what is going on with rural hospital decay and financial disarray in Virginia. Sean, good to have you back, man.
Hey, good morning, John. It's good to be here again.
All right. Now, we do ring a lot of bells here on our show because, as you know, Sean, I'm the beacon of truth in Virginia, right? You know that?
Yeah, of course. Yes, we do. We do know that. Well, we all listen to you.
Well, thank you. And when I'm at Chad Peterson's headquarters on Friday with the Democratic Roundtable, I already told them this is going to be a major topic that we're going to get. We're going to get their comments on. Who do we have up there? We got Scott Survell, Chad Peterson, the Godfather, David Harston, and you can't have one of these without Ben Tribbett. He's going to be there also. So we're going to be fleshing it out there at Chad Peterson's office. It's a lot of fun. Okay, Sean, let's get right to it. As I said, I've been waving my arms here, jumping up and down about the financial challenges facing Virginia hospitals and how, look, it spells bad news for people across the Commonwealth. Your organization, the Virginia Hospital and Healthcare Association, is making this case publicly now with a new public awareness program. Tell us a little about it and how you came up with the idea.
Yeah, John, last week we kicked off the Virginia Hospitals Our Lifeline campaign. And what we're doing is we're running TV ads, cable ads, radio, a lot of social media, and also bus and billboard ads. And what we're trying to do is, we've had a lot of battles about healthcare in Virginia and actually in the country in the last few years. And unfortunately, the battle's become so political, so partisan, that we're trying to remind people that, hospitals particularly, but healthcare in general, it's essential to our communities, essential to our families. They are major job generators in almost every community across the Commonwealth. Yeah, we're finding that we're seeing our financial position starting to slip, and it's basically because the government, which now is providing, we're looking at Medicare or Medicaid or, various requirements to provide indigent care. Essentially mandating that when we provide a service, and I'm not talking about subsidies to these hospitals, but this is actually where they provide a service, and then the government only pays 66 cents on the dollar for Medicaid. It's about 85, 90 cents on the dollar for Medicare, and then zero for indigent care. In fact, VCU just came out with a study that showed in 2013, I think the amount of indigent care provided in the state went up to $1.3 billion, and that is all being borne by the hospitals. And you just can't continue doing this when you're starting to see in the rural areas particularly, and we keep on saying they're the canary in the coal mines because 74% of the patient mix in those hospitals of Medicaid and Medicare, well, almost 50% of those hospitals are operating in the red. Mm-hmm. And some of them have been operating in the red for years. Mm-hmm. And, that just can't continue. And that's going to spread, that sort of disease is going to spread to all the hospitals throughout the state unless we can get the policymakers to really sit down and look at these issues and help work with us to try to address them.
We got to get the political, ideological football here kicked out of the way and solve the problem. Because as soon as you bring up the word Medicaid expansion, Sean, as you know, this is like a lightning rod. People immediately go on one end or the other. And look, we need, as we get into the General Assembly in 2016, Democrats and Republicans, regardless of who is in charge of the state Senate, they have to come together and grapple with this real issue, right?
Yeah, and in fact, that's what you asked about how we thought of this campaign. We thought, listen, in some ways, maybe we've been too good at our jobs. I mean, the hospitals and the healthcare community's been out there whenever people need us in any sort of emergency or any sort of personal illness. And, we're kind of taken, or sort of forgotten.
Right.
And so what we're trying to do is get people to think about, the fact that we're there, how important we are to their communities, to their job base, and that we got a problem. And, it's sort of like any other, challenge you have out there. First, you got people to understand you have a problem before you can actually start to sit down and try to come up with a solution. Mm-hmm. And that's what we're trying to get those policymakers to do.
That's the bottom line. Now, Sean, you mentioned staffing and services. Can you specify the reality of the situation? What kind of cuts are coming down the pike?
Sure. Yeah, in fact, just this right now, this is the first big year that we saw a big jump in the Medicare cuts due to the Affordable Care Act, due to sequestration, and due to some other cuts that are coming in Washington. And this is a bipartisan cut. I mean, one thing they love to do is one way to, pay for various programs, like extending unemployment insurance, even paying for job training programs for the Trans-Pacific Partnership trade deal,
mm-hmm.
was all going to come from cutting Medicare reimbursements. So what we're seeing this year is about $500-600 million. It's going up to about $1 billion a year. At the same time, we're seeing obviously Virginia getting older, and we're seeing that the majority of the patient mix is actually starting to become Medicaid and Medicare. So what you're going to see happening in hospitals, and you are actually seeing it in different parts of the state, the hospitals, they don't initially close.
Mm-hmm.
What they stop doing is reinvesting in those hospitals, like building new capital projects or putting new equipment. Then they stop hiring additional workers. Then they start laying people off. And then they start cutting services. And finally, the last stage is, turning off the lights in that building. That's happened in one rural hospital so far. But if you look at these numbers, I mean, we have several hospitals that have been operating in red for years now, and that just, obviously, at some point, they're just not going to have the financial wherewithal to keep even the lights open.
Well, facts and numbers don't lie, and no entity can continue to lose money. Eventually, they go away. I mean, that's basically where we are right now with some of these rural hospitals. And it isn't only the hospital shuts down, but they cut services out. So people in rural areas have to drive further and further and further for certain services, from delivering a baby to head trauma. I understand the issue. I understand it. I get it. But, there's skeptics out there, people who say, well, hospitals are doing just fine. They make a lot of money. They look at the fancy, awnings that they have, and they look at the marble interior that some of them have in the richer areas, and the expensive machines, and they say, hey, how can hospitals be hurting if they can afford all this stuff? How do you respond to that?
Well, I mean, we got to get everyone to stop looking in the rearview mirror as to where the financial positions were, and then look forward as to what is happening. I mean, basically, when we're looking at the numbers, and the numbers don't lie, when you have a hospital where 74% of your patients are Medicaid and Medicare, and the government now is only paying 85 or 90 cents on the dollar for the Medicare, and that those cuts are increasing, the numbers don't lie. Your patients aren't going to change. Your underlying community population is not going to change that dramatically.
Mm-hmm.
And so what we got to do is get everyone to look at where we are today and where we're going. And again, when you look at where we're going, it's not a very pleasant picture.
Well, Sean, the data is pretty clear, but we cover politics every day, 20 hours a week. So politics is politics, and we all know how it stands here in Virginia. Convincing elected officials in Richmond is no easy task, especially when you have a potential ideological lightning rod issue that we have to put behind us. But healthcare policy debates are rather complex, as you know. They can be contentious. Knowing that, how do you get policymakers in Richmond to understand this issue, accept there's a problem, and work to find compromise solutions?
Well, this is one of the reasons why we're trying to focus on the one thing that every politician loves to talk about, and that is jobs. And right now, there's 115,000 jobs in Virginia's hospitals. another 300 and something thousand in healthcare. 1 out of every 9 jobs in Virginia are tied to healthcare. And what we're starting to see is that those jobs are starting to be in peril. Mm-hmm. And when those jobs go away, they're not coming back. And in many of those communities, I mean, we all talk about economic development. We're spending millions of dollars a year to attract companies to all the different parts of the state. And you know what? No company is going to end up locating in a community without a good hospital and without a good healthcare system.
No way.
I mean, it's just not going to happen.
Right.
And we got to get folks to, you know, I used to be in local government, and when we used to attract and go out there and sell ourselves to companies that come to our community, one of the first 2 things they wanted to look at. They didn't care about, honestly, they didn't care about the taxes per se, or the pad size, whatever. They want to know about the school system and the health system. Those are the first 2 things they asked about. So we made sure that every one of our economic development meetings, we had our school superintendent and the head of our local hospital sitting at the table. Mm-hmm. That's just reality. And I think that's something that we can get to and get all the policymakers, no matter what political stripe they are, to kind of understand and come to grips with this. Because, you know, without a good hospital and healthcare system, we're not going to succeed as a Commonwealth.
We're not. And, you know, I'm glad that you mentioned jobs and the economy and schools, because when people are looking to move into an area, you know, that's what they're looking at. They're looking at what the school system is, and then they're looking at where the hospital is. I mean, this is just reality, all right? You know, we can fight about what the political ramifications are, but like I said, everybody's entitled to their own opinion. Nobody's entitled to their own facts. Facts are stubborn, and they don't paint a good picture right now. Now, Sean, after you communicate this message to the public, then what happens? When will we see a policy proposal actually come to life?
Well, we're working on that right now. We're actually reaching out to legislators on both sides of the aisle, the administration, all the stakeholders, to try and get and find where there's some common ground that we can all start to sit down and work on a solution. And there's no quick and easy fix to this. It's going to take a real partnership from the state level, as well as partnership with the policymakers up in Washington. Because a lot of things that are happening are due to changes in Washington in federal policy towards health care. But the thing is that, you know, we so much of our effort right now is just to get people to understand there's a problem, and then hopefully get them to sit down and work with us on coming up with a comprehensive and long-term solution where we turn healthcare from what I think right now we're kind of considered a liability into what it is in many other states, a true asset. Mm-hmm. I mean, if you go up to, I have my counterpart in Minnesota, I mean, the Mayo Institute, world-renowned, generates tens of thousands of jobs, mm-hmm. and that state up there does everything they can to promote the healthcare system in that state because they see what an economic driver it is.
Right.
And we've got to get that same sort of relationship with our policymakers here in Virginia.
That has got to be a top priority going into this session in 2016 in January. Now, Sean, you and I have discussed these issues several times, and I agree with you. You know, we cannot forsake hospitals in Virginia. We can't take them for granted because all of us at some point are going to need a hospital, either us or our family. And in the moment, we're going to want a top-notch facility to provide treatment. People also should recognize the economic value of hospitals in terms of jobs, the economy, spending money. A solution is mandatory. Other states, led by conservatives, led by Republicans, you're a conservative, you're a Republican, have figured out this issue. We haven't. Virginia is the mother of presidents. It's the home of statesmen. And surely our elected officials in the General Assembly are up to the challenge. But before we take off, Sean, tell our audience where they can learn more about your campaign and how they can get involved.
Yeah, we would encourage people. I mean, obviously we got these ads running right now to go to our website. I support Virginia's hospitals. It's a great website. Just goes through some of the very issues that we're talking about right here. And then also sign up. I mean, we're trying to, get folks to at least get on our newsletters, learn more about the hospitals, learn about the great job opportunities that there are at our hospitals. And we provide a wealth of information both on that website as well as on the Virginia Hospitals and Healthcare Association website, which is www.VHHA.com.
Okay, and the other website you mentioned earlier, again?
Yes, I support VirginiaHospitals.com.
I support VirginiaHospitals.com. I support VirginiaHospitals.com. Sean Connaughton, the President CEO of Virginia Hospital and Healthcare Association. We're out of time. Sean, I really want to thank you for being with us today and for your time and helping me get the message out that we've got to do something about these hospitals in Virginia.
John, thank you very much, and good luck this week being up there in beautiful Northern Virginia.
All right, I'll be there. Sean Connaughton,